but he actually has decent strength and balance in the hind, which doesn't make sense.
Thing going on. The other thing that happens is when those infections get into the nuchal ligament, you got a real problem.
Kind of a hard decision, but
you can cry, it's okay. We've been working on him for so long, and look at you moving, girl.
So Dr. Valerie's coming out to do some chiro work on a couple horses. We are a little nervous for her diagnosis on a couple of them, so we'll see what she has to say when she takes a peek and keep our fingers crossed.
She's having more problems with actually bringing, and it would make sense because we didn't have as much hip movement. We have more problems bringing that left hind up because we're having a mechanical impingement with that muscle keeping it back. She doesn't have it on the right hand side, but it doesn't feel like scar tissue. It really does feel very much like we have a super, super tight muscles. I'm sorry, I told you I was done. I am the worst. Good girl. So we have a decent butt tuck. It's kind of slow, but it's doing. Good girl. You can do it. She's like, no, I can't. Okay. Some sensitivity to digital pressure in those mid to lower thoracics, a little bit in the upper lumbar, and then the very low lumbar. So she's not able to release for that sternal lift.
What she thought was a kick or something on this side. I think right here.
Kind of weak in the hinder there. Oh, yeah. Ooh, that's hot.
It's hot?
Yeah. Got a good temp difference there. So yeah, I would say that has happened in the recent past. She's got a lot of tenderness with that tail pull to the right. I think we're dealing with something more in that sacrum, pelvis, low back that's making it so actually twisting that pelvis to the right hurts more. That's just how she's transmitting to me. Oh, that's awesome. That makes me actually kind of giddy. I love what I do. I think that healing horses, healing animals heals us too. Good girl. So she doesn't seem to mind when I'm doing the distraction with pressure on that pelvis. A bit more tension for this. All right. Well, that side feels good. She's like, whoosh, into that. It's like, yeah, stretch it more. So talking a lot of the classes I went to were on fascia, some of the practical applications of some of these guys that are super tight in the hip and they're still super sensitive after we adjust or wherever it is. Then we start looking at fascia and trying to release some of that. So that's one big reason why laser is the next thing on my list. Yeah, you got some junk going on there, kiddo. The other side benefit is usually once you start working on the fascia, and it's a much lighter touch than like working on the muscles underneath, that around this left hip.
So what is the fascia?
Oh, so this is so cool. So the fascia is what connects the skin to the muscle. So it allows the skin to glide over the muscle. So if you've ever like taken the skin off of chicken, a chicken breast, that's the weird kind of spider webby stuff that holds the skin on there. In living animals, it's actually like almost a huge organ, and it's an area of research because it's really been kind of undervalued. But there's a lot of communication that goes on in the fascia, relaying signals from one part of the body to another. Some of these fascial planes, there's fascial planes that connect the right front to the left hind. So that's another reason why if we have a left hind lameness, we can actually see an issue in the right front. So it's not just, oh, we're compensating. Yes, that's a big part of it. But the other part of that machine is that we have fascial connections between those areas. Yeah, so it's so cool. It's just another way that the machine is all tied together. So the touch that I'm using for this is actually super light. It's like a little bit more than just, you know, stroking her hair kind of thing. But I'm looking for areas where I don't get that nice give in the skin. And then I'm working on that particular area to get that give back in that skin. And around this left hip, she's got a lot where it's just stuck. Now, if we look at how that affects things chiropractically speaking, I always talk about how the skeletal system and the muscular system, so the musculoskeletal system is so interwoven together. So if you have super tight muscles, you can't get a joint moving properly. And if you have a joint that's not moving properly, the muscles can't work properly over that joint. Well, that's another piece of this, that the fascia as a soft tissue structure, if you're having restrictions there, you're not going to get the fluid movement of those joints. You're not going to get the fluid movement of those muscles. It's just so cool. So I geek out a lot about a lot of stuff because it's just who I am. A little bit more on this left shoulder. Interesting. So theoretically, if we're having fascial restrictions in the left hind, we would also be having restriction in the right front because that's one of those fascial planes that puts those together. It's really cool. If you're bored, look up fascial planes. They actually have them mapped out. It's so cool. I'm sorry, I'm gonna take you out of your rest. I know. There, good girl. I can get there. A lot of these are actually motioning out really well. So as soon as I isolate that one particular joint, we're getting that nice wiggle that we want to see. Boom, da, da, boom. That's awesome. Yeah, even that sacrum that was so stuck. Oh, she said I didn't like that. I'm sorry. Now we're finding it. So we always talk about that wooden snake thing. So these are actually moving pretty decently up here. So you can see that nice wiggle transmitted all the way up. But here, we're more jerky. It's doop, 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 doop. All right, same joint. Now we're actually getting that movement transmitted all the way up to the head. So that's nice fluid movement all the way up. You are so tender, honey. Girl. So she's super tender just with me touching on that left side of the sacrum. So I'm not going to use a tail as that fulcrum. Girl. Less dancing, more planting and pivoting when we come back. And when I'm looking at this, I'm also listening to see, especially with that restriction in that hamstring, are we plopping down? But she sounds pretty even on both sides. I know, honey. I'm not going to dig at your divot anymore. I told you I wouldn't. girl. Okay, so you see how far we can come up with this right? Huh, okay, so we do have pretty close to that same range of motion, so this is good, but we're having a harder time with this. So easy. That hurts. I know, there you go. Much stronger. Coming to this left. Let's see if we have that difference in the right. Still got a little bit of that trembling, shaking, but much better. So I think a lot of this was in those lumbars. Why do you have this, baby? She's not sore, she's not hot, so it's not an active inflammatory process going on. Let's see how she does under saddle after this. Because horses can have goofy dings and dents, and as long as it's not impacting how they're performing, I don't really care. I got dings too.
Right, yeah.
It's weird, and I want to know why.
Right.
But at the end of the day, as long as she functions and she's pain-free, I don't care. So it's more of the scientific, why do you have this right here? So, where's that biceps? I don't know. I'm going to stop noodling on it. Tell me how she does. If it's like, no, she's saying we're really not seeing any difference, then I'm more concerned about actually getting in there and figuring out, okay, how are we going to rehab this muscle? How are we going to loosen this up? Some of this may be loosened up just by loosening up that low back and the pelvis. So, she is pivoting better already, so I'm hopeful. Yeah. If we're not seeing a difference under saddle, then we'll delve a little bit more into it. But let's see
how she does.
She's a nice girl.
Yes, she is.
You sure don't look 12. You look a lot older than 12. So we really have a lot of muscle wasting. I can make out the scapula really easily. So we have, and spine of the scapula. So we have lost supraspinatus, infraspinatus, bilateral. Okay. Where are your triceps? Did he come from a situation where he was not getting food, or?
They said the only reason they surrendered him was because his training level was not where their daughter's was. Supposedly they were riding him. And we asked them, why they think he's moving that way, and their only response was thrush in his front feet and he's goofy. And that's what they wrote it off as.
Okay, okay. I'm gonna have a hell of a time trying to fit a saddle, period.
Yeah, if he even makes it.
If he even makes it that far.
Not to be so negative, but I've never seen a horse
but
so
it's
unstable, just
yeah.
existing.
So he's not sensitive to digital palpation, but we have no top line. So we don't have thoracic trapezius, we don't have much of a longissimus, we really don't booty. And he's not particularly he's emaciated, he's an ideal weight, so we should have better muscling. Oh boy. Where is your butt? So his biceps femoris are actually decent. He's also standing base narrow with everything. He's standing like he's on a tightrope. It's fairly classical for neurologic.
Yeah, that was the thing. He did fest okay to the tail pull. And he was okay there. But that was our first instant thought too.
Yeah.
This is something neurological going on.
Well, he's weak, but decent.
Right.
I'm gonna have you, once I get done with some of this goofiness, I'm gonna have you walk him, and I'm gonna be doing some of this while he's walking as well. So we have strength. We're going to be missing sensory. We have muscle wasting. And he looks kind of rain roddy too.
Right, which he's been inside since he's been here, so that was also our question, is how's this horse popping up with these rain rot
Yeah.
scabs when he has not been exposed to any rain in a month and a half, 2 months now?
Hey, buddy, what's wrong with you? What's wrong with you? Can I see you? Hi. I'm going to try to fix it. I don't know if that's a possibility. Hello. Do you like kisses? I like giving kisses. Yes, we'll walk slow. I just want to watch him, and then I want you. We're gonna see how that goes, and then I'm gonna work on the tail pull. If that's okay, I actually want to see him circle slowly as.
We can give it a go.
At any time, I'm like, hey! Yeah.
So that's why I'm kind of like, whoa.
I'm just gonna have you stay there, and then I'm gonna pull his tail. We're just gonna go slow.
He's like crossing his front legs over.
Yeah. Okay. Another. Ability in the cervical vertebrae, that doesn't make it any worse. But I don't know in what, I don't know how, I don't know why.
In what way is it neurological?
Yeah, like, this is weird because he is, to have the crossing over and the instability in the front, that has to be cervical. Some kind of cervical lesion. Yeah, shush. I'm talking. So central or cervical is what's going to cause front limb issues. That can also cause hind limb issues because all the signals have to pass through here to get to. But he actually has decent strength and balance in the hind, which doesn't make sense. Because if we have a cervical lesion, we're having a slower signal down and back. He can't like circumvent that. There's no like workaround for that. Decent size circle. I want him to be turning like we're doing a super tight like lunging circle. Okay, well, that's worse.
Okay.
Okay, let's try the other way. Good Lord.
Just never see anything like that.
Right, and
We seem worse in the left hind. We seem more unstable in the left hind. We still have decent strength. He can stabilize when he's walking in a straight line, not. Yep, I do whatever, but it's like a resting kind of thing. His is dynamic, where he is coming across. He presents as a neurologic horse, and he presents as a cervical lesion. Okay, so I don't think adjustment's gonna help.
yeah, that was kind of why it was more so opinion. Because we hate to, feel bad and
No, I get it.
take all our routes we can,
Absolutely. So this is one of those, sure, I am willing to try. I think he's got some major something going on.
Yeah.
So This is not typical. This is not like, oh yeah, this is an EPM horse.
Right,
but
this is what it is.
Yeah, some of those signs
Yeah.
of that. So I don't know if that's something the road you want to go down of actually testing for the narrow cases, EPM, West Nile, Eastern Western,
Right.
to see.
Yeah.
Because yes, there's always a chance that he's an atypical presentation.
Okay.
Because he's super atypical.
Right, of everything, so.
He doesn't make sense to me. So this is one that is absolutely beyond me, and I have no problem with being like, I don't know. I would think that if there were actual injury, like trauma.
Right. Like
That-
something happened to him.
Yes. So I've seen some goofy stuff where they've gone over in a trailer.
Yep.
Kind of stuff. Actually, with that, we're getting a lot of the trauma response. Like we have major swelling, we have other issues.
Ouch, kinda.
Yeah.
Stop it. I don't have anything for you.
And he doesn't even, have any sensitivity in his pole. Because we can get some not like this.
Right.
But this is jacked up. My professional opinion is he's jacked
Yeah.
up. You can get goofy stuff when your atlas isn't moving the way it's supposed to, but not like this. This is weird.
Yeah.
Hi.
And not good.
No, it's not good. Now the good thing is I'm not seeing any signs of actual pain.
Okay.
So I don't think that he is suffering in any way. He's not reactive to touch. He's not reactive to the tests that we're doing. He just doesn't really care.
On the question of suffering, though, would you, this animal be a pasture animal?
No.
Okay, yeah, that's kind of where I'm at because quality of life
No.
right now is in a confined area 24/7.
Yeah.
So he doesn't go out and kill
So-
himself or fall over on
No.
someone or.
No.
Yeah, so, yeah.
He's not safe. If he were a 10-pound Chihuahua,
Right.
that's a very different
Yeah.
story than a 1,000-pound horse who doesn't know where the hell his feet are in space. So, no,
Yeah, okay.
I don't see him as being safe. Could we track this down and potentially get a diagnosis? Potentially.
Is it a fixable diagnosis, though?
So EPM, you can usually stop the progression. You're not going to fix this.
Yeah.
You're not. Any of those neurological conditions, whatever we're dealing with, we have damage somewhere. I don't think that's going to be fixed.
Okay.
So,
Yep.
That's
kind of what we needed to hear.
yeah. People around him, I think that he is a danger to himself because he is likely to, if he's out in pasture and it's not, even if it is completely flat, he's likely to stumble and fall into a freaking fence post.
Right.
Like, he doesn't, where are his legs? He doesn't know. So,
Yeah.
okay. Crappy. Okay. Super tight on this right side, like not painful, but muscular wise. Come on, you're little. You shouldn't be having these issues. Good girl. So she can resist to the left. I don't know if she was like rebalancing herself or she was uncomfortable or she's like, "What are you doing to me because I'm two?" Okay. If you walk here, walk forward, and I'm going to try to pull. Good. She's narrow. Yeah. So she's unstable with a dynamic tail pull. So she's way bigger than me. She should be able to resist that tail pull when we're walking. So she's way worse than
Yes.
that
and
one
they did
with the
test
tail
her
pull.
for EPM. That
Yeah.
came back negative.
Yeah.
And the vitamin E too, and that was working, they said, for a little bit. And then they quit using it because she wasn't continuing to improve, I guess. And that's that. Here we have her on red cell vitamin E and selenium, because Kristen said to try that kind of as a last ditch effort.
Well, and it's one of those like, hey, we can try it. So
Right, yeah, that's kind of what she said.
let me take a feel on. Yeah. You are definitely 2, aren't you? She's got a pretty decent atlas on this right-hand side. What is going on with your baby cakes? So, that's a pretty decent right atlas. So she's got a lot of stuff in her neck. So I'm gonna adjust her and I'll put her into the computer after this. This would be last ditch. Like,
Kind of where we were at,
let's
too.
try it. Like, it can't hurt.
Being so young, you know, you want to give it a shot.
Aww. Left side's a lot better. Hi, baby cakes. I can adjust you on the ground. Ah, it doesn't happen often. Which is good, because you don't know how to sit still. Just pet me and give me treats. Don't bite butts. We had this talk. We got a lot going on for a baby. Got a whole lot of hope. Pretty significant neurological signs. Weak in the hind. We have a lot chiropractically going on for a 2-year-old. So,
Right.
we'll try it. And we'll see. And absolutely 500% tell me if she gets better. Then
Well, yeah. Right.
But kind of dinky for a 2-year-old too. Like, is there something that is potentially orange that's not allowing growth? I don't know. Did they say that she had always been like this, or
From
it's?
my understanding, yeah. Yeah. And they had originally purchased her, I want to say, as a yearling, and they planned to break her out and use her. But obviously
that you're
that's
not,
the possibility when she's like this. So.
No, that's not shape. I mean, at least she's small, because you know, if a 400-pound horse falls on you, it's a lot better than a 1,000-pound horse.
Well, yeah.
So, like, orders of magnitude. Hi. Well, at least you're releasing. I don't know. See, she had a lot of stuff, but how much of this is that I'm
Right,
in my
kinda
butt and
compensating for-
exactly. So I don't know, and I can't ask her. So
Right. Worth a shot.
it's worth a shot. Get better, little one.
So today, Kylie, what's today?
Today's my last day here.
Last day here.
Yeah.
Why?
I got offered a different job, so I'll be moving on. Kind of a hard decision, but
You can cry, it's okay. We'll miss you. You'll still come around though, right?
of course.
Yeah. Well, we'll miss you and we love you. Well, we really appreciate everything you've done for a lot of the horses here. And a lot of them wouldn't have found homes if it wasn't for you. So just remember that. Take it with you. To celebrate, but not celebrate, Kylie's last day, Lexi and Ray are out grabbing a couple horses. Kylie here is going to ride Dolly, and they're going to go on a little trail ride. Send Kylie off. She'll just realize that she hates the rest of the world, and she'll come back.
You know what? I actually had that conversation with Ray. It's like, watch it. Give me the winter and I'll be back this summer.
Yep. So Ray's gonna ride Delight here, and Lexi's gonna take Miss Josie. Hi, honey. I had to order lunch quick and they took off, but I'll zoom in and you can see them. There they go. We'll see how it went when they return. Here they come. They returned. Delight's in the front per usual. Josie second behind, trotting up. And Kylie and Dolly in the back. We can't see them yet. Everyone's alive again.
Oh, yes. We had a fun ride.
Fun ride.
Oh, I guess we're coming.
Oh, we're coming to say hi. All right. How'd Dolly do?
Very good.
Good. Josie was fun?
Good.
Good. Yay. Well, how's that for your last day, Kai? Very fun.
Going out on a good note.
Yep. So we have an owner surrender that just arrived. We didn't get any info via email, but Buddy?
Yeah.
Okay.
Pictures.
Yeah. What's up with Buddy?
Buddy is 20 years old. He comes up lame when he has an adult or a bigger rider on him for long periods of time.
Oh.
So he's just not really working out with them.
Okay.
So here he is.
We'll see what we can figure out. All right. Well, we'll get Buddy here into a stall and figure out what's going on.
I said, of course, to the horse.
So, bittersweet day today. As you've heard, Kylie is leaving us, not forever, but she's gonna take Larry home with her. And hopefully he doesn't take out her fences. Happy ending all around. Good job, buddy. All right, drive careful.
We'll be back later.
Don't take chances. See ya.
All right. So Dr. Kristen has arrived.
She's starting up.
She's ready for another day at Ponytails. We got a lot of horses to get through, so we're gonna get started.
This is Thunder.
Is this Thunder? Okay.
I suppose that's all.
Okay, no, just making sure it's actually him.
You first, bud.
Is he a surrender then, or everything today is surrenders? Okay.
Yeah. Yep. We haven't been doing auction in a while.
25 is the idea for 198. Okay. And he's
He's just a grumpy old man.
you're a grumpy, skinny old man. Yeah, another old skinny palomino. You guys are good at getting them.
What they said.
You said a stifle injury is kind of his concern? Hey, sir. Thunder. You say a grumpy old man. Can I see? Make sure you're actually that age. You're going to be grimping. Yeah, you've worn him down pretty good, haven't you? How does he seem to eat?
Not terribly.
Okay, I mean, being
No
as
quitting or anything. He drops a bit of green.
okay, I mean, being skinny, it wouldn't be a bad idea to do a dental on him. Well, did everybody have a good Thanksgiving?
Aside from a little bit of food poisoning. Yes.
Oh my gosh, you're kidding!
Yeah, so we got the bad pie.
It wasn't from the bird.
No, it was some kind of like custard pie, but like I know when I looked at it, the meringue looked really hard and like it looked really watery and like almost separated.
Oh, so she bought it and
She ate it,
oh,
and then like she said like a half an hour after she got home.
but interesting.
And I told myself, I said it looks good, but I just don't think so.
Yeah.
I'm glad I did not.
Yeah. Oh goodness, that's not good. My in-laws had a little bit of that too, and the one ended up. She went to the doctor, and they found she had a bleeding ulcer in her stomach even. And we're like, she's asking us, we ate all the same stuff you guys did, and we're fine. So I don't know what you got into. Or they didn't say which one?
Hey, we're one of those people that didn't give too many details and said he just couldn't keep up for the riding they wanted to do. So.
Well, he's 25 and he's kind of thin anyway, so maybe we got a little bit of room to maybe do a little bit of a walk.
Seems like he kind of walks.
He's kind of weak.
Outside of his
Yeah.
feet, too.
Everybody's real curious about the new guy. You talk about how he kind of drags that left rear a little bit too. So it didn't feel like I could feel any effusion in the joint or anything like that. But he's got a little bit of a swollen sheath too. Hey, bud, I know. I mean, there could definitely be some chronic changes in there. I just don't feel any active joint swelling right now. The stifle injuries are pretty common in horses, so maybe we'll get some muscle and weight on him and see if he starts picking that leg up a little bit better, because, yeah, he's dragging that toe.
Okay.
So, all right, we'll just get some weight, and if he can't gain... do you clean the sheaths, too?
If they'll allow it, we will.
Yeah,
And if it's needed, yeah.
Yeah, might get after his, and of course it's been cold and he probably hasn't been moving a lot. That could
Yeah,
be some
he's-
of that. Yeah, it says, yeah, that might be a little bit sore. Yeah, he's into his 20s. He lost the groove already. Yeah, you just don't like your feet being picked up as much anymore. That's better. Yep. So sure, a little bit of a stifle issue, but he's old and he's probably got arthritis in it now. Hey, take it easy. Okay, I won't do it anymore. I won't do it anymore then. Okay. You stand square. Fine, step forward. He even has maybe a little muscle loss on that side. Mm-hmm. Okay. I would still say let's get some weight on him. You can butte him if he needs it for the pain or if he seems uncomfortable. He's slightly neurological, but I wouldn't rule out a stifle injury either because he doesn't really care to pick it up. So, and watch the sheath.
We need to do chain his short.
So up next is Buddy. Another buddy, yes.
Buddy is said to not be able to handle an adult rider and go for long periods of time.
Older boy then?
Yeah.
Supposed to be 20, I
Supposed to
think.
be 20, and that's all they told us.
But we thought his
Feet definitely don't
feet look
right.
funky. His front feet.
He seems stocked up a little bit too.
Yeah, something.
His Polly hasn't been on him yet.
No, he'll be here today.
But you guys haven't been on him or done any training evals or anything. Maybe he'll be like Arwen.
Hey.
You kind of look like her color-wise.
Right?
Move your head this way. It just seemed like, okay. I thought maybe he was missing some muscle in his shoulder, and it was just the way he was holding his head then. Buddy, I gotta take your temperature. Don't get too excited. That is a goat.
That's a goat. That's one of two goats.
I'm sorry, he's standing up.
Yeah. He had to get put on that cell because he figured out how to jump out of that.
Oh, my dear. Okay. Well, the joy of goats. Everybody's just a little cool today.
She'll learn.
Can I see that again?
Better look at your teepees.
Yeah, you're old.
Past 20 old.
Yep. And he did have a little messed up incisors there.
Yeah.
Can we look again? She wants to film it. I do. I really would like to. How about I rub your nose? I rub it, I rub it, I rub it, I rub it, I rub it. There. Perfect. What do you think, huh? He says that feels good. Just rub my head. Just be a ring bone horse. Yeah. You could do x-rays of that, and like we talked about with the last ring bone, you never know how it's going to progress. Like some horses are great for a long time, and some horses in 6 months they're dead lame. So we'll just see. We can x-ray him for fun. But yeah, so do x-rays, I would say all of them, and we can move him, we can watch him walk a little bit here. If you just want to walk to the garage door and back, then I just want to see him walk a little.
Those two down there.
They're like the greeters. He doesn't really pick them up, does he?
No.
Let's see how, we'll pick up his feet and see how his hocks bend then too. He says, it's nice outside. Oh, he's got good range of motion there. Yeah, I know. Yeah, right? But I mean, I was wondering the way he wasn't picking his feet up if he couldn't really bend his hocks. Yeah. That one's a little stiffer. Doesn't really bend much more. Okay. Let's, do x-rays down here, and you could do his hocks, but definitely see how much ring bone we got going on. Ooh, that one popped pretty good too. Polly will have fun with these feet. I can hardly see a frog in there. And you can feel some knobs, so I'm sure he's just full of arthritis.
Yeah.
Old guy. Yeah. Gonna be digging you out. Look at that. Jeez. So it's like both his left hock and his left knee are both a little bit decreased.
Right now.
Yeah. Okay. Well, my main concern with him is arthritis, ring bone, those kinds of deals. So
Okay. Get
He
some
could-
X-rays then.
do some x-rays, and he could probably do okay with pain medication and light rides with a smaller rider and all that, but we'll just see how he performs.
Yep, Lady Lily. She's supposed to be 30 years old. Is there
Okay.
anything specifically wrong with Lady Lily?
Lady Lily, I want to say possibly some arthritis. She mentioned she's supposed to be older, in her 30s.
Yeah. Okay.
Sure.
She could use some weight and possibly dental.
Oh,
Other
yeah.
gals.
Yep, definitely. Look at you. You look like my old mare. What did she have? Oh, yeah. She big, big old knobby knee.
dental.
Yeah. Hi,
Supposed to be
sweetie.
30.
What do you have in you? You look like you have like Mustang in you or something too. But you have a bucking problem, huh?
No,
Or
that's
no,
the other
that's
one.
the other one. Okay.
This one is apparently really broke, but
Hi.
she's got.
But she just, oh, hey, hey, hey. Hey, hey, hey. What do you even have left? You have a lot of grass stuck. There. You got a broken one? Yep. That one's kind of ouchy. Yeah. She says I got a Jethro gap. See? I know, honey. Yeah, she's definitely older. We take a look at this big knee of yours. Hey, you're impatient.
Cody, calm.
Yeah, that's a. Look how crooked her foot is too. You're walking funny because of your knee, making your toe goofy. Yeah, can I see it? Thank you. Oof. Obviously, we don't bend a lot. That's all she's got. What? You're an old mare with probably an old knee injury then if it's just on the one side, but turned hard.
Yes.
Okay, C-O-D-Y?
Yep.
Okay, and he's a big old boy. Red Roan. Hi. He's a little bit, everybody seems a little swollen in the sheath today. I guess they're not moving as much and they're a little, it's a little cold out. All right. 20 question mark. But we'll double check that. You're pretty. Sorry, stuff on you. What do you think? Can I look? Yeah, he's an old man. Yeah, into your 20s, well into. She doesn't have much left. He says, I'm wearing him down to nothing. Wearing him to nothing, sure. But he didn't have, we don't know, like, if he was a riding issue or what his trouble.
Just the bucking problem.
He was a bucker.
Yeah.
Okay.
Yep. He came in with Lady Lily.
Oh, you guys are friends. But nobody's tried riding him yet.
Not yet.
And then we'll watch you move a little, huh, bud?
This way. He's so big.
Seems to be moving okay, so I'll have to ride him and see what the deal is. Like,
Do we have any soreness in his back or
What's that?
anything like that? I said, do we have any soreness in his back or?
they never, so you said they never did. I mean, you could try and then see if Dr. Wodak wants to take a look at that, but he doesn't care. You'll have to see what, like you say, trying something different, saddle pad, and seeing what he does with you guys. Maybe he doesn't, so.
Well, and I imagine he's a hard one to saddle fit as well with the way it's built, so.
Yeah, I was feeling
That
his
could be a
withers are pretty big.
contributing factor, yeah.
Tawny was an adoption return. She's got a big. She was dropping a lot of her food, so I think she'll possibly be a dental.
Okay.
Other than that, the
Oops, I
lady
one
didn't
spelled
really
it
give much of a reason why she was bringing her back. So she definitely came here underweight, and then.
How long was she gone for?
Oh, how long was Tawny gone for? Like a year?
2 years.
Oh, so she's been
Yeah.
gone.
2 or 3
Okay,
years.
long enough to make changes and stuff.
Yeah.
All right.
Touch on the diarrhea.
So then you
That I
had,
did not.
oh, she's,
So when we first picked her up, she had like almost explosive diarrhea. It seems to have gotten better since she's been here. I've switched her to, it's called GI Soothe. It's a more gut-friendly grain, and that seems to have helped. But
okay.
I don't know. Almost wondering possibly dental. And,
Wouldn't be
yeah,
a bad thing.
I mean,
How
she
old?
looks like she's gained some weight since she's
In her
been here,
20s.
but
20-year-old?
she definitely needs weight.
You are old. Yeah. She doesn't really have any top line muscle here. That's always tough to get back on, the top line muscle. And she's older, so then we start opening up that metabolic can of worms too. So we'll see if we can get some weight on her the old fashioned way, but if not, then we start talking about blood testing. I know, lady. I'm gonna take your temperature, don't get mad. Likes to distract us. Okay. All right. Well, we're gonna have to get some weight and top line on her, and if the GI Soothe is working great, and then the parasite check, of course, like you guys are doing.
What'd you think about her eyes?
They're just, she's visual and everything. She's just getting a little haziness in the lens with age.
So not only do we have Dr. Kristen here, but Paulie is here also. He's got a lot of horses to see today, but we'll get through it. Haley's here to help. So up next we're gonna do Stormy here. Have Kristen take a peek, and honestly, possibly Paulie at the same time for those feet.
Oh, you're so skinny too. Yep, you're pretty old. Into the 20s. Oh yeah, well into the 20s. I'm assuming Polly might want those x-rayed to see kind of how close we are to having something break through.
Yeah.
Okay. It's interesting when they start to go out like that too. Then that bone could be about anywhere in there.
Yeah.
Can you pick up one at a time, or is that kind of hard for you?
Do we want to pull out the x-ray machine quick for this?
Yeah, if you guys think you can snap a quick one. Yeah, there's not like a straight way of doing it. Okay. I don't know if you're even going to hold that thing up for Polly.
Yeah, not the way he just laid
Yeah,
down.
I don't know how we can do that. Yeah, unless you can do some of this trimmings, just letting him stand.
Yeah, like that. He'd probably.
Okay.
That's good.
I'm surprised he's walking as good as he is. I'm gonna take your temperature. You're very, very skinny. That might be kind of nice. Stormy, here's the thing. I just want you to stand on it so we can take a really good DP view. It's real simple. It's real simple. Real easy peasy. Step forward, buddy.
Oh, that actually did well. They both got in there.
Do you remember which way was which? It's a lot of ring bone. Looks terrible.
This is gonna be his left side. This will be his right side.
That's how it's set?
Yeah.
So we gotta get the markers at some
This
point.
is the right side.
So that's where it'd be really good if we could get him up so we can actually show Polly what the foot truly looks like. So
There's a lot of ring bones, sorry.
there is, yeah. P3 doesn't look terrible though, does it? It's not dissolved.
Surprisingly.
Yeah. Well, let's see if we can get a DP on this guy. All right, I gotta move the board. I know, I gotta turn it. Well, I know, sir. It's weird. He says, one at a time, lady, one at a time. Be patient. Hey, perfect. Thank you, buddy. Thank you, bud. All right, let's do this direction on this foot. So, yep, this guy like here, and then always this. Always is lateral. Yep, always on the outside, whatever you're X-raying, which we can put it closer because it might not be in your beam.
So here good?
That's a good point. We'll find out after this.
Yep, if you can straighten it up and yeah, do your best because he's not square at all.
Holy shoot. The marker worked.
Shows you how much of it's really metal, right? Yeah. Poor guy.
What do you think about that?
It's never, yeah, that's not gonna get any better. That's just horrible arthritis in a ring bone, yeah.
What's his age?
He's 25 plus, 20 plus,
20. Yeah.
Yeah, 25.
and he's skinny.
So up next, we're gonna do the goats. We're gonna start with Stone. Hi, Stone. And then we'll go over to Emma.
Here he is.
Hey, Stone. Come here. Here we go. Yep, you smell like you're retting.
And he's being cute.
Is he peeing again? Yeah, he's got big man parts.
Yeah.
101.2, normal for goats.
Oh, that's good to know.
Goats run hotter
Okay.
than a horse,
Cool.
yep.
Good to know. Before we're like, oh my god, our goat's sick.
No, he's not sick. Yes. Well, the horns are for heat dissipation, too. That's actually what they're
when they were
for.
warm yesterday. I told her, I was like, this is
Yeah.
weird.
We don't know much
That's-
about goats.
That's what they're designed for.
Don't know much about him.
Yeah, babies. He is young yet. These are, looks like he's still losing his babies. So you said he was 2?
That's what they said, yeah.
Okay. All right. Nope, that sounds good. Yeah. And adult castration. I know that you guys had asked about banding. Not the best when they're well, look how big he is, and it'll be painful, and so honestly, surgical's a little better.
Yeah.
I tend to sedate them because then they're not. Well, mostly it's your ears too, because they scream, but
You just do it like how you do the horses here?
pretty much. Yep, they get a little cocktail. We drop them down, and they just get
hear
cut on the
that?
bottom of the scrotum. I just cut the bottom third off, and we take it out, and their nuts come out actually quite a bit easier than a horse. They're sort of hooked up a little different. So,
Solid.
yep, and it's yes, goats are very susceptible to tetanus. Usually that's more with the banding and stuff. So the other option is pinching, where I use a different. Basically, it's called a Berdizo, and you essentially just crush the cords twice on each side just to try to. And it's bloodless, so you're not cutting anything off. The only problem with that one is there's always the chance that you don't have complete killing of all the testicular tissue. And I had one goat grow back a little bit of a nut, and then he turned into a bud again and was headbutting his owner, and then I had to go back in surgically. So ideally, surgically, it's all gone. You don't have to worry about it because he's going to be a pet, right? So,
Nobody on TV yet.
but for the people that don't want to see blood and they get really worried, then I just pinch them and we see what happens.
Yeah, no, we're okay with blood.
Okay. Yeah. So we'll get the tetanus on him. The CD&T is really easy. It's under the skin. As far as goats and like cattle and things like that go, it's just under the skin and the neck. It's not in the muscle like with horses. And so you just have a shorter needle and you kind of go in at a 45-degree angle and you'll feel it kind of pop through the skin. If you're comfortable with it, you can tent the skin even and just go underneath. But CD&T is a very cheap vaccine. He can get a dose, you can booster it in 3 weeks, and then we'll talk about cutting him on a day where it's not too awful cold. I don't want him getting frostbite because you see that's kind of a lot of tissue hanging back there.
He came with another stud too, so.
Wasn't it a female?
Horse.
Oh, a stud horse. Okay. Gotcha. Gotcha. You're cute though. You like your floppy ears.
Are you comfortable microchipping goats? Because Ray's not comfortable doing it where they're supposed to be done.
Under the skin in the ear?
I don't
Yeah.
want to do that. Or, I'm not gonna
If you-
lie, it was under the tail was the other one, not necessarily
In the fold. Yeah. So they'll do that because some like La Manchas and breeds like that don't have a lot of ear, and so they're doing it in the caudal fold back here. You feel this little bit of tissue. But as far as that goes, I mean, the ear, it's just like doing, well, I guess you guys probably haven't done any implants, but it's under the skin in the ear, you just slide it underneath there. And we can always do that when he's sleeping. Okay. So if you guys are okay with knowing who he is without a microchip for a little while. Yeah.
Just mostly before he goes home.
His heart and lungs sounded good, his temp was normal, 1012, normal goat.
Normal goat.
Yep. And so they were together, and there's a good possibility that she's bred then, huh?
They've been together since mom had babies, so yeah.
Mom's still got a bag on her. Did she have babies come off of her when you guys?
No, there were no babies there,
Hi.
but there was no.
Hey, Mama. Yeah, so somebody tried to dehorn her, and they got the one side, and the other side grew back a little. But it's attached really good. Horns are not for restraint because you can damage them, just so you know you can put a halter on them or use a collar or something like that. I just wanted to feel it. It is attached pretty good. So unless this curled around and started like growing into her face or something, she can just have it. Or if it got caught on things a lot, then it would be a surgical deal. Goats are a little different than cattle when it comes to horns, and they're just more sensitive. Hi, sweetie. Why don't we just take your temperature too?
This is Emma.
All right, you can just hold on tight to her collar, and then we can push her into the wall if we need to.
I got the handle.
Hey, Mama. Just calm down.
Ow, girl.
Ow. How do you like that?
She didn't.
Wow. You got a big old bag on you. You shut it off when you pushed it into the wall. I'll touch that after. You can see if Sarah wants to do a goat fecal.
Do a goat fecal?
She had a little bit of mucus. What's that?
I don't know. What do they get? Same things as horses, dogs? I don't know.
A little different. But you can just do it. You can do egg count. We'd want to see if where she ran away. Okay, that's okay. It'd be the strongyl type eggs that we're looking at.
The strongyl eggs?
Mm-hmm. Yep. Let me see her eye. So you look color in goats.
Okay.
She's got decent color. We could have a little bit more weight on them, but not bad. She's still got, in goats, we're feeling this transverse process and then the backbone here, and she's still got some muscle in here. It's not rounded out like a fat goat, and it's not sunk in.
Yep.
So that's a good spot. You can actually feel her backstrap muscles there. How about your udder, though? You hold still because I was wondering. Oh, goodness.
Oh, we're climbing the wall.
Okay. You're a crazy goat. Don't kick anybody.
She is a cute goat.
Oh.
Oh. Angry little thing.
She is.
Oh, thanks for that.
Sorry.
No, you're
Does it
fine.
does it look like mastitis?
It's clear.
So it's not. She's not.
No, it doesn't look down here yet. Okay.
Mama, you just calm down. You're not as friendly as your boy. Okay. It's okay.
Do we think she's with children?
I was trying to feel.
To let you pet her.
Yeah, she's so tense. But I mean, that's why I was wondering if she just had. Okay, we can let her be. I was wondering if she just got kids taken off of her, or if she's bagging up like she's getting ready to have another set.
There weren't any signs of.
The lady said she wants to be pregnant.
Okay. Well, then just look forward to having baby goats because they're the cutest thing.
They are.
About that?
They're the cutest thing in the world. That's what you need to know.
Yeah.
So
Do you have to do anything special for them?
they get dehorned right away. So let me know when they drop. And you can keep the navels clean and stuff, but for the most part, as long as they get up and nurse on her. If she has like 4 or something like that, then she might need some help. Because, right, she's only got the 2 sides. I can't feel any, but she's been with them. But she's bagging up, and it's not milk yet. So I don't know if she just had some taken off or if she's just getting ready to have another set.
Yeah. This is Cordelia.
No, she was the one that had the terrible feet. A lot of ring bone, just like Stormy.
And some of them are really hard to tell because, like, the hoof, you know, everything's just like kind of circling in front of it.
Oh, yeah, like the whole hoof was in the way.
Yeah.
Huh. And then it does get hard to tell, like, how big P3 really is because it looks like there's not much to it there. And she's got nasty arthritis all up and down in there.
That's
Yeah.
the right one again still.
I think the only other thing to do would be to put the x-ray in the tunnel and actually try to x-ray down in this direction more to really get an idea of how that bone is looking. You went all up and down the leg.
Yeah.
Look at that. She's even got, all her ligaments are so messed up that these are all like attachment points that are getting all arthritic and nasty because, oh.
That's the one we just looked.
That one looks like that proximal joint. Like there is no joint there. It's so completely fused. Look at this. There should be a... Okay. So...
Open up top here.
Oh, you... Okay, I see. I see. I see what you were doing. Let's go back down there. Okay. Like we talked about, usually when they're really bad like that for a long time, there's no P3 left. It just kind of, you don't see it anymore. Does she seem like she's doing better as you've worked on her a little bit, or?
The only thing that's kind of changed is like when she was so out this way, like the legs have
They've come in a little?
kind of straightened themselves out, but you know, all that going on in the joint, I mean, that's just not going to go away.
No, it's not.
And
It's basically the same thing as like a ring bone, but when it's fused, it decreases her range of motion, but when it's fused, it shouldn't be as painful either. Right? So, I mean, they fuse joints on purpose when they're really bad. And so that's basically what she's already done right here, is fused part of that pastern. So, I mean, maybe there's just so much other arthritis going on, too.
That worries me with the shifting.
This was her left, I want to say, right?
oh yeah, how everything's kind of like
But she had enough foot under there, didn't she? To
More
deal
than enough.
more than enough to deal with if we.
Yeah. I feel like the only way to get her good is to get her laying flat out. Just
She's been hard to trim because
like
of
layer
that.
down.
like lay her down if possible.
Okay,
Get her knocked out.
We ain't got them kind of drugs.
I do.
mean,
I got the
Like,
drugs.
I have the drugs.
So, okay,
I mean, I guess I don't want her suffering and like in pain, like every day of her life.
she's always laying down, isn't she? Still.
not as much, not as much as she used to.
Okay.
But like, I don't want to put her through all this if she's just still going to be hurting every single day, you know. I just don't think that's fair.
Right. Well, and it's hard to say too because she's put all that weird stress on all her different ligaments, and then you straighten her out, and that might hurt too, because changing it.
She's been that's her normal.
Right.
And then you put her
Right.
back to how normal is
Then you
normal,
put-
and it hurts all over again.
Well, and I was reading something, that thing that Ray sent about the ring bone, how they say what actually causes the ring bone is imbalance. And the ligaments and that stuff trying to make sense of it, and they want to become bone.
Yeah, it's that fusion to try to help with instability, right? So if something's off, that's like what the joint is trying to do. But then once it's completely fused and it is stable, then theoretically that should feel better. Because we do injections to fuse joints. So,
I just thought that was interesting that like the ligaments want to become bone.
well, and that's where you see
so
like,
when they're like being stressed, they start to like calcify and become
right, there was a
ultimately
view.
ring bone.
Right.
Right, you can see like along here even, and this is way up in her fetlock, so this, her right one is worse significantly. But you see it's all kind of fuzzy right along the edges of the bones there too, and so you'll see like these hooks where the ligaments are attaching, because that's how they're starting, is they're trying to fuse or correct an instability. The right one is a lot worse,
Yeah.
because that one's going clear up her leg, and so that one must be the one that's even more unstable, because she was so turned out. She's so young.
Oh no. So I don't know. That's kind of where we're
Yeah, the left didn't look as bad up high in the fetlock.
like the coffin bones look decent, I thought, which I was shocked with, but
Yeah, I mean, everything's off, but
right. But everything else is kind of
I don't know. I feel like it could be interesting to try, because she's never going to be a rider or anything like that. And then, theoretically, if everything's all fused up in there, but I don't think she's never going to walk right. So it's going to be hard to tell how much pain is she in, but if she's laying down, she must be in pain.
well, and then like when she goes outside, like 'cause, they're supposed to have the 5 freedoms, and if she's worried that if there's a predator and she's not gonna be able to get away, like that's not really fair to her psyche, I guess, as far as that goes.
Yeah. And we've had her here for several months now and done a couple trims to try to straighten that out, and that's about as far as she's gotten.
Yeah, until we did these, and then it's kind of where we just put it on hold.
Gosh dang it. It's like you kind of want to try with that, but she's got the changes up in her right fetlock too. It's like that's not just her coffin bone. It goes clear up the leg. There's a lot of other things going on because of how everything's been so messed up for so long. So, and the only way you think you could really get a good trim is if we did lay her out.
Because she's gonna lean so heavy when
She's tough.
Yeah.
Okay. Well, we're gonna have to think about that then, I guess. I haven't looked at her since that first day that she came in. Is she in the barn yet? Okay. Well, maybe we'll just take a look at her and see what we think.
This is her normal. You're looking like any of the other ones. She's gonna be in twice as much pain.
Yep. Yeah, she says, I don't even want to step with those if I can help it.
Just have a really
Yeah. Maybe you're just kind of talking about her a little bit. If she wants to step a little bit, I suppose. That's right. That left one kind of goes in, and then the right one goes out. But this one has enough. Her right one is the one that had. Hi, sweetie. Had the more bony changes. I don't remember. I don't think I looked at this.
No, we tried to X-ray that.
So yeah. So now she's probably got changes up in her knee. They're going to be really sore by putting her straight.
Well, in time, would they figure themselves out? I know you don't want to do the drastic changes because that's too much too fast, but I don't know.
She's just been like this for so long that there's bony changes along with it. So it's not as simple as correcting where, you correct them and then their ligaments are sore, but then they get over it. But now she has bony changes to contend with at the same time. So, I don't know. I wonder if this happened when she's so young. Look how much lower she is in her withers.
When she's what, 6, 7
Yeah.
years old, I think now.
She's just not. Okay. Well, that's what I mean. Like, is something also didn't grow right here because this happened to her so young? Her legs didn't elongate like they should have.
Be that butt high at this age,
No.
Sock
Obviously,
at
she'll
this point.
never be normal. I thought she was going to be a little bit less sore.
Right. Because like the biggest question is like, will she ever be comfortable? No matter what we do, will she ever be comfortable?
with that amount of ring bone change and stuff, no, those horses are sore. It's just how much can you manage with pain medication?
But
And
at
then
an
is-
early
then is she
age,
on it
you're
all the
really
time?
gonna get
She's on it all the
worse
time.
And have to up that.
Yeah. I don't think so.
This is Abby.
Abby,
A-B-B-Y.
Came with the goats and that one.
and your legs are a little bit goofy too.
He's also pretty bullheaded.
You're bullheaded. How old are you? I like
the
your
form said that
I like your ear
she
tips.
was teen.
I think she's an 06 or something.
I was just gonna say I don't know.
What you said? Form said 16, or
Her,
6?
she's papered.
Yeah.
Oh.
06 or 07 was.
Oh, I see. I thought you said 16 and then 6 or 7. Hi.
Well, Abby, calm down. You're so angry all the time.
Okay, well, I mean, I guess if she's papered, yeah. Abby.
Look at her feet.
Yeah, everything.
Yeah, that's what I mean.
She's like, knees go out, then the foot goes in, and
Almost like
then,
if you make her stand on it, it'll straighten out.
well, the knees themselves look a little big. Hi, sweetie, I'm coming down to see your friend. Yeah, but if you actually feel at the knee, she is out in the knee, and then she goes back in. So, oof, yuck. See, look at that. You bend it, and it's way out here. 'Cause they're in. I hope she doesn't have rotation or something at the same time, because she's out in the knee, and then she's over in the knee at the same time. Like, if you just feel her leg, you can feel it go in. Yeah. Like it's swept in. Like, well, her knees are out, yeah. Ooh, that one's terrible. Oh, that's literally all it can do.
But it,
It like goes in, yeah.
everything, it kind of all runs together though.
Yep.
Like
'cause
this
she's-
is straight.
Because the knee goes out and then it kind of comes back in. Or at the knee, everything starts to go in like that. But I think that was just a conformational thing that she had. And then here we are. She's not built right. It's just funny how the top part of her iris kind of bulges out on both sides. So above her pupil, and that little brown thing is the corpora nigra, and that's normal. But you see how the pupil kind of bulges out above there?
Kind of looks like she has like two.
It does. That's
Yeah.
the pigment in that one. But on this side, you can just see how it bulges out a bit. I thought she had a mass or something. So it could just be that she just has a weak spot there.
Has a what?
Like a weak spot in the iris. Because as they get older, irises do atrophy, and you can get tears in them, and they start to look a little more mesh-like. But maybe that's what she's got going on. It doesn't really look like a mass. Because they can get melanomas and stuff like that in their pupils, or in their irises. And then she'll be a good x-ray, and then she's never going to be straight, though. She's going to be like that other mini that you had a while back that was kind of all pretzel-y in the legs.
George, the hind legs.
Yeah, yeah. So she's kind of like that in the front. All Arab?
Yeah,
Okay.
no doubt about it.
Sounds good. You seem like your feet look sore too, your knees. Oh, look at your... Is ring bone our diagnosis of the day? Look at how thick her pasterns are.
Look at, well, yeah, I'm not trying to knob on her knee.
Yep.
On the bright side, though, she does seem mostly sound when she runs around.
I don't know, she is standing kind of,
Yeah,
yeah.
not right.
Nope. All right, did you have...
They came in with Stormy and the goats. They all came
Oh,
together.
Stormy was with this group too?
Yeah, that Pete with the really bad feet.
Okay.
Yeah.
Were there any left there, or did they get
We
rid
took
of...
them all.
Everybody?
Her house was condemned.
Oh,
Yeah.
okay.
Quite a neglectful situation.
Gotcha. Okay. Hey, sweetie. Here, it looks like her lip hangs over a little bit. I wonder if she's parrot mouthed. You get nipped at? Oh, you do have a snip. Oh, I just.
There's a little smacking under the
Oh, you're not. You were just letting your lip hang
Yeah.
funny. I thought it looked like she had no chin. Hey. Hey.
Not when it comes to ponies. Nobody has control.
She was being good out here, and then as soon as she got away from her. But then she was out here without her.
Yeah.
And she was fine then.
Well, and she was freaking out in the stall when she was without
Oh,
her.
you
and now
guys,
she's
are you
being-
not used to being stalled? Is that part of it?
They had no fencing. They were wandering just in the woods. Literally no fencing on that
I
property.
see. You guys just don't like to be held back.
Yeah, they. Well, and she had no electricity, so they went through it all.
They like their freedom.
Yeah. She's got a big old cataract in her.
Yeah, she's lost a lot of vision in that left eye from that cataract. It's a pretty one, yeah.
Yeah, her whole foot is turned in.
Yeah, she's. You can just feel how big that one is.
So that's why I think all the ones from the same group are popping up with spring bone. Yeah, because
Well, look at her angle here.
Extent and have the same farrier, if and when they ever had a farrier. Or lack thereof. Yeah.
Very toed in. It can go quickly, it can go slow.
Yeah.
You never, wing bone is kind of one of them, like on a pre-purchase exam, that you can't tell them a lot. Ooh, this one has really decreased, that's all I got. So that one hurts a little. Well, hopefully, yeah, and hopefully she'll stand good for farrier work.
Yeah, she's supposed to be 5 years old.
Okay.
These people bought her from the Amish. They said that she got hit by a car. These people did everything under the sun, apparently, except for get a vet.
And she's got wounds up here.
Yeah,
So like she was hit while she was pulling a buggy type of thing?
That's what we
Or?
assume.
Okay.
we're not entirely sure.
That's good, Mayor. She's like, oh, you got me. How long ago do they know the injury occurred?
They said they'd had her for at least a couple months. And that's why the sheriff called us, because they're like, this horse needs to see a vet. And they're like, well, we can't afford one. And they said, then we need to surrender her.
Sure.
But I think we might have to sedate her to get
I think so.
a good look at that.
I think so. But I'll just take a quick look at you, honey. I'm going to come around behind you. Maybe she'll be good for that. Hey, baby girl. Can I just touch your shoulder? I won't touch your owie. That would almost be a good one to x-ray.
Yeah, I think the sheriff's vet said they thought there was probably like debris and stuff in there.
That would be my guess. Because for it to weep and be for that long, there's something going on. The other thing that happens is when those infections get into the nuchal ligament, you got a real problem. Hi, sweetie. No, I'm just going to touch other places on you. So I want to make sure you can have medicine.
Touch your head. You're okay.
Yeah, it's a stethoscope. Yeah, you're a biter, we know. Your guts are moving good. Hi. Yeah, it's like you can see a hole. I wonder how it looks if it goes all the way through. Like there's a hole right here. I don't know how deep it is. Yeah. Phew. Oh, that stinks. Okay, I don't think I want to go back by your butt since we don't have full control of you. Would we be ready to try to tackle this right now?
As far as what?
Sedating and working on it?
I mean, if you are, I am.
After we get our knots tied here? You know, it's like there's
The
no...
clip won't work.
Yeah. I don't know how you could even put a halter on her. I'm going to see if I can go to the other side and just take a look. Okay. But for it to be draining on both sides. Makes you think it's like a through and through type of deal. And anytime you have a wound that's on top of, like, then it's hard for it to drain and then it becomes a chronic issue. She could have a chip of a bone in there. She could have, you know, something in there. And that's what you said that the vet on the humane deal was saying. Well, sweetheart,
But they did everything they could for her. We loved her so much.
did they give her penicillin shots every day?
They had experienced horse front tell them.
They're the heroes because they kept her from getting killed. That's all. That's
Well, at least she's got a decent amount of weight on her. I suppose she's not skinny.
Hopefully she's not pregnant.
Yeah, there you go. That's the
Her
other.
too.
She's interesting because she's not a standee, she's not a draft, she's something else. I mean, we get a bucket of water and I'll start, what I would want to do is sedate her, and I'm just going to trim the heck out of that because I want to see what's going on underneath. And while she's sedated, we could try to snap a picture and make sure that there's not like a bone chip or something awful, because if we get to that point, that's where she's going to still water and she's getting it flushed. And she's getting IV antibiotics and all the works to try to get something out of that. Because if there's, once you get to the point where you'd have to dig in there after bone fragments and different things like that, we're getting a little more advanced. So, but we can't even really see what we're dealing with yet. And so if we could just get her sedated and clean it up, we're going to start there.
Okay.
Yeah, you're going to be a good girl. You're going to be a good girl. Oh, we were so nervous that you were going to be upset. Your heart is just racing. Thought maybe I'd just brush some of this junk off so I can see what's happening. Yeah, that's the thing. I don't know.
I guess unless we just kept it loose.
It's right puffy, right down here. I know, baby. I'm gonna come to the other side of you. We just gotta watch her muzzle because she kept offering to bite.
Yeah.
And I don't care to be bitten. Oh, honey.
I thought it was sticking out from the foot. I don't know. No, she's.
Man, these are really stuck and disgusting. I think I'm gonna have to just shave all this.
She's got her cookies in her teeth.
We'll see what we can do here. Oh my goodness.
Maybe we could just put you in the fire.
It's gonna take a little hot minute. Let's see here. I'm making a little bit of progress now. I know I'm getting near your ears. Is that goofy? I'm just taking off everything that looks yuck.
See as much as we can.
Well, and if it's just gonna keep draining, it's just gonna keep sticking like this. Ugh. Yeah, we're not in a really good time of year for wound care.
No.
Other than not having maggots, that's nice, because if we had maggots, we'd be taking turns throwing up here.
Yeah.
I'm just gonna feel better getting all this crap shaved off your head. Poor thing. She's like, it's my ears, I'm sensitive. If they were taking care of your wound, they would have at least clipped it, honey. So you could see what we're dealing with. I know, that's the one that bugs her right here.
Do we see anything?
I got one hole right there, and I'm trying to clean out this. I'm gonna have to clean out my clippers again. I don't know if you can see that hole.
17, yeah.
Just having a hard time getting it to clip because everything's kind of glued up again.
Like right here.
Yep. Just a hole so far. Oh, gross. Not that big of a hole left. Oh, I know. Poor thing. There, see, it goes in one and out the other.
Oh my gosh.
There. That's the fountain.
Oh my goodness.
Cool, huh?
It's flushed out.
Yeah.
Well, it doesn't actually go as deep as I expected. Oh, it's a good girl. Oh, sorry, I'm getting your rope all stained up.
That's not okay. It's bound to happen sooner than later. Ropes are replaceable, Julie.
Yeah, we fix her up. She has a hole on the other side too, and it's more swollen over there where I wonder if I need to reopen that side. Maybe she'll let me just, on the other side, it's, it looks like she had one that closed.
Yeah,
You see? But it's still kind of puffy, like there's more in it.
yeah.
So that one I might need to, see how it wants to drain right there too? That one might get lanced today.
Oh yeah.
So I'm kind of thinking that one I might need to open. But it's here and it's here, so I don't know what she did. if we want to, if you guys are set up for the x-ray, we could probably do that next before I make too much of a mess. And this one, what do you have it on? A 72 1.0?
1.6.
Why don't you increase it to like 84? Because you got a little, yep. Like 84 and 2.0. I think we got to go a little harder to burn through a neck. Perfect.
Oh, I'm in the way.
No, you're good. Well, that's not as bad as I thought, but her, I don't know why her vertebrae looks kind of, it's a little blurry. She must have moved a little on you.
She is. We can try it again.
Yeah, it just seems a little fuzzy, where it's like maybe the infection did get down into the bone then.
So should I go a little more towards her ears? So we can
I think you actually got it just perfect. I just don't want it moving.
I just need it to hold still.
Is that little hole?
Yeah, because these are the holes, so
Okay.
like that's we're exactly where we want to
Good
be.
angle, just need it to hold still.
Yeah, good angle, just a little fuzzy.
Okay.
And I think we have good technique as far as the KVP and whatnot.
Yeah.
I don't know what this little piece is in there. If that's like a little, it's hard to say.
Zoom in on this screen.
Oh, okay. It's like, is that just a piece of dirt or something that happens to be over it? Well, what we're going to do is we're going to clean it out really good today. I'm thinking about lancing it on the right side where it feels like there's some more fluid, where it's healed over. Okay. And then at that point, I'm just going to have you guys kind of flushing it and keeping it clean. So let's see what it does when I kind of clean it out some more. Nope, I guess not. Good girl. I thought I was going to get a bunch of pus and that'd be more fun. So what I'm going to do is kind of slit it a little bit on the way out, I think. Hey, you just take that easy. Just blood. Well, we're going to let her heal with some antibiotics then, 'cause who knows if she had a lot of them or not.
What would you recommend using for an antibiotic?
Either Exceed or Uniprim. But if we don't know how she's going to be for injections and stuff.
Right, yeah.
But Exceed would be nice to use. Actually, at the same time, wouldn't hurt. I'm going to go behind you, baby. We haven't done that yet. You don't mind? Exidine solution.
Ooh, I'm gonna back up though.
You're going to back up. There, I can kind of get it in there. Aha! Look at that. Fountain!
Oh my goodness. Are you having?
Oh, are you?
A little bit. Like a little fountain.
Like a fountain. A whale spout.
Pretty much. Good girl. There you go. If she would let you do that every day, that'd be fantastic.
Yeah. Right.
She's pretty good. I mean, she's kind of cooled off quite a bit when it comes to this. And there's not that much of a pocket there anymore. Yeah. It's kind of healing funny how it heals like in, but there. As she puts her head down, I wonder if you couldn't get a view of like all of it from the top. So you can see where she was all scraped up and had wounds here. Oh, baby, maybe as she gets sleepy, she'll put her head back down. Really not that much was coming out of there. I thought that was going to be a little more dramatic, guys.
So last time Paulie was here, I believe it was, he said that he was getting Halo some fancy wedges.
They're in the barn already.
Oh, they're in the barn already? Okay.
I'm just grabbing other ones.
Okay, well, we'll go in the barn and see them then. We're gonna go in the barn and see them. Okay, are those Halo's fancy new wedges?
Yep, I got frog support, 3-degree wedge, silicone, extra cushion.
Fancy, fancy.
I wouldn't do this with that mule.
Good though?
Yeah. I'm gonna. How do you think she'll do? Let's like shoe her in here and then take her out and file her on the stand.
Okay, we can give it a try.
It's just so hard to make that look good from underneath.
Yeah.
So we're pulling Sunny down today to see, yeah, get a reset done, see what's going on. And look at how she's moving though. She was so dang stiff. We put her out to pasture and look at that. Yeah, her feet were so bad. We've been working on them for so long, and look at you moving, girl. Go, Sunny. Go, Sunny. I know for sure I was really worried about her knees, but I think we even took x-rays and didn't see anything going on. And now that she's moving them around like this, oh, that's so good. Yeah, this is even on rocks. Look at that. Look at her moving.
Look at you, spicy, chubby little thing.
She
She
does.
looks great.
She's lost a lot of weight.
Compared to
Getting better.
when she first came, she was like,
Even her knees. Oh my
Yeah,
God. Holy shit.
we weren't too sure.
no.
Look at you, girl.
Do you want to look at the x-ray again? I don't remember which was which, but I know they weren't the same. Yeah, it seemed like one was pointed down more than the other, which I didn't know if that would mean like different.
The right one we're gonna have to change a bit. Still better than what you were.
Yes, tons.
And it'll be a lot easier to shoe you when you're not all kitty wampus under there.
That is so mean. That farrier just hopped on her. What a pig.
Ready?
I don't know, maybe I will take you home.
I'm not gonna have to take a step inside though.
No, don't make her move. Huh? I don't want a halfie. I about died from a halfie. Shut up. Maybe that's why maybe my spirit animal is a halfie. In the stock you go. Yeah. You still want that trauma bond, you little troll looking?
Over here, we are getting little Abby x-rayed.
Getting her set up to x-ray. Really? Yours? There we go.
What are dead souls?
So like with hers, her soul was all like shedding and dead. So you get this right here, like this flaky, you can see how it just peels out.
I see.
And with hers was so bad, she had like the false soul layer where it had almost looked like it had, where the bars were had grown down so bad in the beginning where it had looked like a soul, but it was, you could get in there and just pull it all out. So this is still the aftermath of the stinky stuff. Huh?
Doing anything different to her this time?
Well, being we got the x-rays, we were able to take a little more heel this time. Judging by the coffin bone, she had too much. So instead of keeping her too high and it rotating more, I just brought her back a little bit for comfort, so maybe she won't be so.
All right, Sunny, you're all done. How's that feel?
Look at that major growth.
Yeah.
Get a picture of that.
Oh, Sunny, sorry.
There's a face there.
There is a face there.
See? You need to hold still.
What's your
Pony rides.
You're the perfect size.
Only that way.
Okay, that's good.
You're about as motivated as me, so I hope.
Oh, good job, Sunny. So, even though Kylie's gone, we don't have another trainer yet. Ray knows what she's doing, so still got to keep these horses moving. So she's gonna do Tawny's initial eval today, and we'll hopefully get to a couple others. In case anybody's curious, the white stuff on her back is just delousing powder.
I think she might be a little off in the back.
Little off in the back. Okay, good to know. Oh yeah.
We'll see how she does with packing up, but I probably won't get on her.
Okay.
Might be a Cairo issue.
Good girl, Tawny.
It's like spiky on this side.
Nice try, girl. So Miss Dolly's going home today. I gotta drop her off. They don't live too far, so it'll be a quick trip. Oh, girl. You'll be happy when you get there. You got friends waiting. We'll get her loaded and get on the road.
Hey, Megan, here.
For you. Oh, we're gonna be sassy mare.
Was not accepting the attitude.
No. Oh, Dolly. All right, 2 hands on deck, I think. All right, we got her.
It's a little mayor attitude.
Off we go. Right, 1, 2, 3.
I said, of course, to the horse.
There's our friend over there, Ellie. She looks kind of excited to meet Dolly here. Here they come, Dolly, your new friends. I'll help ya. She's so excited.
She was pretty friendly.
You guys coming to say hi? Woo! Look at her go.
That's the most I've seen Ellie do in a long time.
Oh, that's awesome. Yeah.